pressure.
And you're doing it. That's the hard work.
Well, I appreciate that. Good afternoon. Pleasure to be with you.
Good afternoon.
The clicker. Yep. I'll fumble through a little bit just because I did have some videos I was going to share and jump over to a different screen, and that's okay. QR code is just for my LinkedIn. If you want to connect, please do. We share a lot of very useful, helpful information in our community. We call it our tribe of really innovators, but systemic change makers. And just a real quick little bit about me, what my background, how I'm standing in front of you today. Age 22, find out that I had an undiagnosed hole in my heart, ASD, and needed emergency open heart surgery, senior year of undergrad, final semester. So ended up going through with the heart surgery after diagnosed just about 30 days later. Finished out school, but before the Affordable Care Act, I was considered an uninsured individual or uninsurable individual. So by necessity, I had to figure out how in the world I was going to have health care coverage when I would graduate in May. Through that process, quite honestly, I realized that I was a finance and accounting major, decided I would not go on to the big city career job, those sorts of things, but instead I would start my own, then it was an insurance agency, now it's a consulting firm, but within 363 days of that open heart surgery, I began my business. Fast forwarding a bit, just a few years later, a friend of mine who was running the medical school at Ohio University, Tom Campanella, mentioned to me, hey, I'm going to transfer to a different university, going to go run the healthcare MBA program in Cleveland, Baldwin Wallace healthcare MBA, you should consider enrolling. I said, why would I do that? I'm not running a hospital, I'm not climbing a corporate ladder, I'm an entrepreneur. He said, it's not about the education, quite frankly, it's the social capital. So signed a loan for the entire amount, entered in 2005 in my healthcare MBA program, and that's when my world just really changed. Shook a hand of a gentleman, and this was the handshakes, but a gentleman that owned an independent third-party administrator that does healthcare plans, files claims, pays providers. And he said, Bryce, if you come with me, I'll put you under my wing and I'll show you how to do really innovative things for employers who purchase and deliver healthcare for their employees and families. And so really that was the beginning of really understanding that, as Larry was trying to spit out there, he was labeling me really a plan architect. That's kind of a term that I enjoy, because like an architect, you're putting all the parts and pieces together. You're designing high-performing health plans for people, and a lot of times the work that we're doing are for low healthcare IQ folks. Sometimes working middle class, a lot of times working poor, and they don't have a doctor or a nurse in their family. So when they enter into a healthcare setting, they can become a sheep. They can quickly just into the system, the sick care system just runs them through the mill. And so we create high-performing health plans that try to impact, most importantly, it's patient-centric, but impact the health outcome of the member and really remove a lot of the misaligned incentives of the fee-for-service business that we all know as the sick care system. So I am from, and Larry said it correct, I was actually going to stump the crowd and see if anybody knew how to pronounce the town that I'm from, Ashtabula, Ohio. Okay. Ashtabula is, it's an hour east of Cleveland. It's a port city. It was actually one of the largest ports at the turn of the century on the entire Great Lakes until they moved westward, Cleveland, Chicago. And so in Ashtabula, it's important for you to know that it's a Rust Belt town. You know, for many, many years, you know, steel mills closed, the port really slowed down, jobs left, manufacturing left, all these things. We have a very, still today, very strong plastics manufacturing economy. The Corvettes are made by a company called MFG. All of the the fenders and things are in Ashtabula. But why I'm mentioning all of this is because before I began to really know and understand the power that I had as a change maker, I really thought, hey, it's broken, I can't fix it, I'm going to have no impact. And we could all take that mentality and that mindset. But I think before us, I'll share with you, we proved in Ashtabula County, and by the way, the 8th poorest county in the state of Ohio, and the largest county by geography in the state of Ohio. Okay? So a lot of the social determinants of health are real. Just like any big city, we have big city problems, we have rural problems. We're a healthcare desert, you name it, we experience it. So with that being said, and by the way, I'll share with you in a second, just till recently, but I served on our local county health board for about 2 years. And what we're talking about here today, about expanding primary care in underserved populations, I worked on a project for our local health department to accept a state grant that could put primary care on site in our schools, in all 8 of our public school districts. And only to have bureaucracy and fixed mindsets vote against me on my healthcare board, including 2 physicians and 2 nurses who served on that board, vote against it. Vote against taking $2 million of grant money from the governor's office, who said, you need this and you should do this. And so I resigned off of our health board just recently. These are the types of things that I'm talking about. This is the view out my office window. We were in a 1890s Queen Anne Victorian home, and it was a dream of mine to have my office move there. I see that sunrise just about every morning, except in the wintertime, and it's gray, snow, and wind chill. But this is our working port. You can see there's a ship in the background, lift bridge, all the really neat things. But it's a working class town, as I mentioned to you. And what I share with you here, engaging a community to shine light, give hope, and fuel transformation. It's healthcare transformation. If you stop and think about the ways that healthcare affects and impacts working class families, again, if you're sick or disabled, you're probably not going to do real well in a town like this. You're unable to afford healthcare, access to care, all of these things. A very high Medicaid and Medicare population here. Okay? But at the end of the day, the vast majority of my community, when they see me out on the streets or running, etc., they know I'm working really hard to help transform our community and fight back against Wall Street and the sick care system that's been stealing from our community for far too long. Some of the demographics around the city of Ashtabula. I think I shared most of this already, but I will share with you that our main hospital inside the city of Ashtabula is an affiliate of the Cleveland Clinic. They just underwent a $110 million expansion, a new patient tower, as they're referring it to. It just opened this summer. And then we have 2 critical access hospitals in both wings of the county that are very small and really just serve as, again, critical access. But notice I underline no independent labs, imaging, or primary care throughout the county. I recruited a primary care physician to move there and open a business, a brick and mortar, to serve our public entities in the county as a direct primary care doctor. It's funny, he took the website domain, and it's called ashtabuladoctor.com, because there's just one. It's what? Dr. Brad Schneider, and I love him for it, because now I've just continued to share that. But this is what we're dealing with. So if you need these types of things, most of the time, it's going to be a hospital-run service, unless we move them out of the county to go seek the services. Now, I saw in the agenda, we've talked social determinants today, socioeconomics, we just mentioned. I'm sharing with you, this is really Dave Chase, our founder of Health Rosetta, says this often: the future of healthcare is local, open, and independent. It's not Wall Street run, it's not big hospital system run. local, open, independent. That's from providers, that's from caregivers, it's from employers, okay, who know and understand the obstacles and the barriers of the populations that we're serving. And so this fine example was the past 2 summers, we've had a lot of our staff, friends and family. This is the local, this is a nonprofit organization that gives away backpacks full of school supplies and a pair of tennis shoes for every kid that shows up. We capped them out this past summer. There were 700 people in line at 8 a.m. waiting for a backpack and free school supplies. And we also give them a not so healthy lunch, but something that we can afford to provide. And I share that with you not at all to make light of us doing good work or good things or volunteering. It's so that you understand what we're working with and dealing with is a very difficult population to serve and really try to change their health outcomes. And in order to do so, you have to know and understand really what we're working with. And again, there's no better way of doing it than from the local perspective. A lot of the population, again, public entities, so school teachers to school bus drivers, cafeteria workers, municipality workers, so sanitation, fire, police, EMS. Financial barriers are really, for us, we believe, one of the #1 barriers to great health outcomes. People just avoid care. Most of working middle class Americans have these higher deductible health plans. And to somebody, and again, prior to the COVID stimulus money, Wall Street Journal reported 70% of American households had less than $1,000 in savings. So if you have a deductible, a medical deductible of $2,000, $3,000, $4,000, $5,000 per person in your family, you're not seeking care unless it's an emergency, unless something is seriously wrong. And so with inflation and all the things that are happening in our world, most of these folks are being stung right now. But I'd like to say in Ashtabula County, for those plans that we manage, that is no longer a financial barrier. The high-performing plan that we provide, it's free primary care. It's free labs and imaging. It's free surgeries. Like there's 0 deductible, 0 coinsurance, 0 out-of-pocket members, as long as they go through either their direct primary care doctor or their concierge nurse navigator that works and is assigned to their employer. Okay? So why are we here? Why am I here? So I read this book, and this is Dave Chase's first, The CEO's Guide to Restoring the American Dream. The subtitle matters more to me than anything: How to Deliver World-Class Health Care to Your Employees at Half the Cost. Now that was a very good first book. Dave's done more since then. His latest is called Relocalizing Health. And again, I would recommend this one. You can get it on a Kindle for your flight home or pick it up on Amazon. I buy these in the hundreds at a time. I give them to decision makers, employers, and when I'm influencing direct primary care to an employer or a board, like school board, this is one of my gifts all the time. Okay? Read this book, it really just opened my mind and the way that I was doing business. Secondly, I read this book by Matt Kelly. Anyone read The Dream Manager in the room? Okay. This is a great, it is a great book. It is an emotional book. You can read it on a flight. You can get through it quickly. But it's a case study on what happens in working class populations when you can help from an employer perspective, from a provider perspective, when you can help people reach their dreams and when they don't have financial barriers in the way. People that have never been able to purchase a new car or purchase a house. And healthcare plays such a role in that. Great 2 books. Read them both. I pass them both out often, is because the power of what we do can help people more than we realize. So I share with you mindset shifts. So one of the things that, again, a lot of physicians, even already existing direct primary care doctors, will say is, man, I have a really hard time selling myself or my practice in my community or to employers. I don't know how, Bryce, or I can't seem to get any of these employers to agreeing to this program. And so I share that with you because for me, I went into my public school, the school board, the administration, I went to city management, the city council, all those things, and I just brought the doctor right along with me. I said, come with me. They're going to ask questions, tell them about yourself, but we're not going to talk clinical. We don't need to get into things that they don't know and understand. And see, when you start to speak clinically to a CFO, a COO, or a CEO, they check out because they didn't get trained in that. Mm-hmm. They don't want to hear about it because you're speaking over them. Mm-hmm. And I noticed that. And so I tell that to my DPC docs. But what I do go after, and I do share with the physician, is you've got to go after the EQ in the room. Speak to the emotional side of things and what the impact of direct primary care can do for these employees and their families. One of the things that I took away from the NUCA system of care, and again, if you've studied this at all, this tribal population in Alaska, is they talk about the number one driver of health outcomes is actually, I think it's self-confidence is what, if I could say it simply. But when you're talking to a workforce, and whether it's employers or just a patient, you have to get inside their head that they can achieve these things. We can do these things. We're able to fix the system. And so I share that with you because this example here, I want to say this was a local construction company. Actually, I have two nurses in this picture. You can see the hard hats. We go in and we do change management meetings. We try to shift their mindset that, hey, the sick care system has been harming us all for so too long, and we're the cavalry, we're here to change these things. We have a physician in the room, we have a nurse in the room, and this is your new care team. So when we started to do this, at first, of course, people push back, well, wait a minute, what are you talking about? But see, once you start in a community, you start with an entity that's well known, like a school district or a city municipality, it starts to grow. It's almost like the snowball effect or wildfire. They talk to each other. Labor groups talk to each other. Public leaders talk to each other. Come and do this for us. Tell us how you do this, and you win the buy-in of our population. And that's really what we're talking about, is you have to gain the emotional intelligence of your audience or your patient to understand what you're there to do, and it's going to be impactful to them. I don't have the links built in here. I was throwing this together just recently. I was going to share with you two videos, and you can go to our website and check them out. My website address is ienrisk.com, ienrisk.com. But they're an investigative reporter, ABC News affiliate out of Cleveland, came just last summer. And he knocked on the door. By the way, when an investigative reporter shows up at your door, you think twice about opening, your arms to them. But in this case, the guy said, hey, I was told to come out here and visit you all. Whatever you're doing here around healthcare for teachers and firefighters and things, I've heard about. And I'd like to talk to you about what you're doing. If you don't mind, could my film guy come in and we sat down? So that's on our website. It is powerful. The teacher union president's on there. We've got the community pharmacists, all these things. But the work that we've been doing all along these past 4 years is starting to be seen and heard all throughout the state of Ohio. So our model in Ashtabula, what we've done is really what has been kind of coined lately as the advanced primary care model. Now we do it, we're siloed, meaning the physician's independent, the pharmacist is an independent community pharmacist. We have our nurse navigation. I also own a clinical nurse navigation company. My business partner, who is a nurse, a former transplant coordinator, she runs that entire arm or division. But we've got the nurse, and then we have, some of you all have heard of Centers of Excellence. You've heard of a guy named Tom Emmerich, perhaps, out of Walmart, Lowe's, British Petroleum. He created Walmart's Centers of Excellence program that they run today for high quality complex disease states or surgeries. So we have what I just said, DPC, community pharmacy, nurse navigation, and a Centers of Excellence program, because everything we do is all focused on high quality and appropriateness. Okay? Advanced primary care, siloed patient-centric care team is exactly what we do. And we serve as the shepherd for these patients. And it's really, really cool on how we do it, but it's really, most importantly, it's relationships. It's the same mantra that primary care has had all along. You have to win the emotional intelligence. That patient needs to know, like, and trust you, and every time they seek care, they're thinking, I'm going to go to my care team before I take the next step. That trust, in Ashtabula County, we have over 50 and as high as 74% patient engagement. So of all the belly buttons, all the people we serve, 50 to 74% of them are calling us before they go do healthcare. Okay, that's very impactful. We serve as shepherds. Our health outcomes are driven because we do no longer have cost barriers for our people that we serve, and there are no misaligned incentives. For the direct primary care doctor, Dr. Schneider, there are no RVU goals. There's nothing that's pushing or pressing on him to make referrals. He's working on a capitated financial model. And in Ashtabula County, just to give you an idea, he's capturing $75 per adult per month. The employer pays 100% of those dollars. I recruited him to come to Ashtabula. He's been here with us about a year and a half. We nearly have his patient panel full. He wants to just be at about 500 patients, but take 75 times 500 per month. He has no employees. Everything is run on a practice software called Hint. His EMR is called Elation, and his telemedicine program is called Spruce. They're all integrated to each other. 75 times 500 a month. He's 48 years old. I think he's got a great career ahead, and he's doing really, really, really impactful work. Our community pharmacist, we had stayed on stage in DC last week, Maria Fowler. I contacted her. She's the last standing independent community pharmacist in our town. I said, Maria Fowler, you don't know me. I'm calling. My name is Bryce Heinbaugh, and I can change your life and your business.
For 1990.
She answered the phone. She picked up immediately. We embedded Maria, her pharmacy, into all of our health plans in Ashtabula County for all employers that we serve. Everyone can go to Hoffman's Pharmacy. Their drugs are free up to $500. They're all generics. They work completely with, she works with her, I think she has 7 pharmacists there. They work with the DPC. They work with the nurse navigator. We've transferred, I believe, nearly 50% of all scripts are getting filled at Hoffman's Community Pharmacy instead of CVS, Walmart, Walgreens, and others. Changing her life, yeah, it's really, I'm telling you, it's very, very powerful. And she's the one that, again, like I said, is the sponsorship banner at the Little League, at the YMCA, after school programs. It's her pharmacy. It's not, we don't see CVS and Walgreens sponsoring those things. Our nurse navigation company, that's them, Concierge Nurse Navigators, and then Edison for the Centers of Excellence. No misaligned incentives, just the patient, and that's the focus.
Who's the TPA behind it?
That's a great question. On the ones for Ashtabula County, remember that handshake I told you in 2005 I shook in my MBA program? That gentleman's name is Jim Farley. His little boutique TPA in Cleveland, Ohio is called JP Farley Corp. They're the ones that serve and administer all of our Ashtabula County roads.
And are they renting someone else's network?
Yes, we utilize the National Cigna Choice PPO. Yep. But we have a lot of direct contracts. By the way, before I go any further, I should have even mentioned it. By the way, as I mentioned, we shepherd patients to high quality and appropriate physicians, providers. Through our data software that we subscribe to, we found that the #1 orthopedic and spine practice in the entire state of Ohio is located in Akron, Ohio. I'm doing a LinkedIn search of all the C-suite, CEO, COO, CFO. All 3 of them come from the same healthcare MBA program that I went through.
Oh, wow.
I called back the director. I said, Tom, I need a personal introduction to the CEO. Can you make it happen? I reached out to them. Their name is it's the Crystal Clinic Orthopedic Hospital. And the CEO there is named Dan Ferry. I said, Dan, my name is Bryce. I know we don't know each other, went through the same program. I'm in the place that you don't want to actually build a brick and mortar, but I have a model that will serve you right. I would love to have a direct contract with your practice. And if I do well enough, if I provide you enough patients that I believe, again, appropriateness, all the things, would you consider coming to Ashtabula? Last summer, they opened a brick and mortar across from the Cleveland Clinic Affiliate Hospital, 500 feet, Crystal Clinic Orthopedics. And so, again, in a market, a healthcare desert, as I refer it to, we have, again, world-renowned in this entire country. They're, I think, 21st in joint replacement in the entire country for outcomes. Spine, they're right up there as well. We have a direct contract. We don't rely on Cigna. And by the way, as long as everyone comes through the DPC or the nurse, all their orthopedic care is entirely free. Okay? Extremely powerful, you guys. And by the way, yeah, I'm about out of time. 5 minutes. Okay. So this article right here, how many read it? June 23rd. And I didn't put WSJ up there because I don't have the rights to do that, but that's where it was. Okay. So one person raised their hand. So I got in a really bad screaming match with some leadership at WVU Medicine in West Virginia. Anybody from that great state? So we serve underserved populations in West Virginia, big privately owned companies. WVU Medicine started to really push back on the work that we're doing. And about a month ago, I was on a call, Zoom meeting, and I said, let me just explain to you what you're doing. And I know for a fact that you all read this article, but when hospital prices rise, people lose their jobs. This article is actually out of Harvard and Yale. I think it was a combined study, and they published, Wall Street Journal was the first to really put it out there in the mass media. But this is true. When I got called to West Virginia, multiple employers said, we're going to either have to terminate jobs here, or you find us another solution for healthcare. And that is the truth down there. And so, nonetheless, this article, use it in any conversation you're having, because our model that we're doing, direct primary care and this advanced primary care, this avoids, this doesn't matter so much when we're doing what we're doing, okay? So with that being said, last week in DC, I just want to explain to you, I said grow like wildfire. This is our community pharmacist, Maria Fowler, she's the owner. These are our two nurse navigators for all of our organizations in Ashtabula County that we serve. This is my business partner, Casey. This is the largest public school superintendent in Ashtabula County, Lisa Newsom. Back here is the city manager of Ashtabula. By the way, this is all bipartisan, so it doesn't matter that I have a Republican county commissioner and a Democrat city manager. We're all on the same side of the table fighting back against what has really been breaking our community. They were all three, the county, the city, the public schools, were awarded a Rosie at Health Rosetta's national conference last week for the most innovative and impactful healthcare plans in America. By the way, we've had 3 more counties in the state of Ohio call us up in the last 45 days and say, tell us what you're doing. Guess what? We need DPC docs. So here's my last thing. Okay. Community-owned health plans, we'll go into it later, but we just opened an office in Crested Butte because of an acquisition, but the entire Western Slope, we're rolling out a COHP called Western Slope Health Plans. I'm in need of DPC docs, if you know any. We've got one that we're really comfortable with, but I have 16 employers that we need to roll this model out with. Kansas City, Kansas, it's actually our 2 newest clients, the Archdiocese of Kansas City in Kansas, and then the Archdiocese, or the Diocese of Arlington in Virginia, Central Florida, Dallas, Fort Worth. These are areas in which we are seeking bids and offers for physicians for direct primary care, and we want to expand this exact model that I shared with you in all of these markets, and we are launching these in 2025. So with that, that's all I got. And I got to catch a flight shortly, so I don't know if there's any Q&A or not, but I'm finished.
Because I can only imagine that orthopedic, like having, let's say, a knee replacement or like back surgery is quite expensive. So how are you guys able to make money with your model of patients not paying anything for at least the specialty care, primary care?
Yes.
That I can
Yes.
get.
Great question. So the question is, well, how in the world are you guys saving money when you're waiving all the patient responsibility? First off, appropriateness is number one. Again, knowing that, over 20-25% of orthopedic surgeries are inappropriate.
Yeah.
We avoid waste, abuse, those things. The direct contract with these orthopedic practices is very strong. We cut out the middleman. They don't chase dollars. They get paid quickly, so they're willing to take less. They're not
Got
having
it.
the bureaucracy of insurance companies, those things.
Got it.
So really and truly, if we're able to do a total knee for less than $20,000, all in, and they take risk, all day long. If that knee was done at Cleveland Clinic or somewhere else, that could be a $40,000 to $80,000
Got
surgery.
it. Okay.
Yep.
That's
If
really
you
good.
want to have some fun, and I really mean this, if you want to have some
Yeah.
fun, go to the Free Market Medical Association annual meeting. It will blow you away when you start hearing the surgeons and others who love cash.
That's makes sense.
Yeah, you don't need Wall Street. They're
Yeah.
And their
unnecessary
quality is good.
money handling middlemen. I'm leaving one copy of Relocalizing Health and 2 copies of, these are all case studies out of Health Rosetta. These are all public and private employers who've done this model,
Awesome.
and they've all been published. But you'll see direct primary care is in a lot of them. I'm going to leave these behind for whomever may like to take them home, but these are really great manuals on how we do what we do. So thank you all very much.
Thank you. That's really good.